Now, I'm certain that every single one of you in this room at some point over the last year had to be very concerned about your organization's healthcare costs. But do you know the exact number of employees, workers, independent contractors in your organization who meet the medical definition of obese? And exactly what percentage of your increased health claims costs over the past few years you can attribute to that so that you can come up with a defined, specific plan to do it. Now, I've been very impressed with this group. All day long, I've been very intently looking at everybody around the room. And this, more than just about any other group that I've seen in assembly, because of the nature of what you do and who you are, has a smaller average waistline, if you will, or body mass index than just about any other group. But there's a very good scientific reason for that. There are reams of data that suggest that in order to be highly productive, highly energetic, successful executive people, you've got to have the energy to get up every day and put in a 12 and 14-hour day. And you can't do that unless you take care of yourself, you get some form of exercise and health-conscious activity that enables your body and your mind to perform those activities. And that's why we're left with a much healthier than the average American assembly sitting here today at a Kentucky Chamber organizational event. That's not by accident. That's very scientific and very provable in our research. So I'm going to talk about some of the data that we have that goes along with these two some symptoms, sometimes diseases, obesity and a little bit about diabetes, and how it's affecting your organization. Not just the very clear and easy to measure increased health claims costs in your group health plan. That's very clear. There's a lot known about that. That's an incredibly important topic, and we're going to talk a little bit about that. But there are many other ways that it infiltrates your organization and increases your costs and decreases the average productivity of your employees that you need to know about and come up with some sort of a strategy so that you can figure out a way to improve things going forward in this globally competitive marketplace. Now, many would say that public health advocates and doctors and kooks like me are jumping up and down saying this is a bigger issue than it really is. That obesity is just one symptom of the American culture, the American way of life. We all have our personal freedoms to do what we want with our life, and we should be able to do whatever we want. And in fact, we can run around saying obesity is suicide, or in this case, death by sausage. On the other side, you would have food companies and some other organizations say, really, this is just hype by public health people, doctors, and other groups. But it's not really an important aspect of our society. We need to focus on the more tangible things we can get our arms around, do something about, and lower our costs in our healthcare structure. Somewhere in the middle, though, is the truth. And it's easy for us as rational, successful adults to put that in perspective and understand that we need to make good, healthy choices in our life. But imagine, if you will, a bus on its way to high school with perhaps all of our kids on board who stops at this stoplight, and they see two competing messages during that 30-second glimpse that they get. One is a good public service announcement. We're educating these kids to make good, healthy choices. And the other one gets at the two things that really resonate with kids. One, immediate gratification of something that tastes good and feels good. And two, our natural inclination to consumer behavior on the bottom. And it's not a knock against McDonald's. They're genius marketers because they're going to win this fight every single time from almost every kid on that bus. So it's an uphill battle that you, the employer, receives unhealthy kids once they matriculate into the workforce, and then they become your problem in our employer-based healthcare system until they come out the other end 30, 40, 45 years later. So we need to figure out a few things we can do about it. You've all seen these graphs over and over again during the healthcare reform debate. Obesity is different than being overweight. Obesity is a medical term, a formula based on a relationship between your height and weight that has clear statistical increases in health risks and risks of increasing the cost of your care through time. A different measure than just being slightly overweight, which doesn't, in fact, increase healthcare costs. We have currently about 1/3 of all adult Americans as being considered medically obese, about 34% right now. That's projected to go up, as is that of the overweight status. The problem is all of the public health metrics that we use to judge how well we're doing, we're absolutely failing in every possible way. The federal government, the CDC, and other organizations every 10 years put out a document called Healthy People that essentially enumerates what our goal should be as a society for any of a host of different health risk factors. Our societal goal is to have a 15% obesity rate. We're projected to be well more than double that. And as I'm going to show you, the current and recent global recession that we've had is even going to bend this curve upwards, where all we heard last year was how we're going to try to bend the cost curve down. I think, unfortunately, we've got some bad news in the way this is going to play out in terms of our personal health risk factors. Obesity, again, not just a cosmetic issue. This is a definite, clear, linear, direct relationship with an increased risk of a host of different health risks and health factors in our lifetime, all the way from simple things up to cancers and beyond. But it's even greater than that. And that's why my main point may be to suggest to you, don't look just to the healthcare system or somebody's doctor to try to fix this. It's a dramatically larger socioeconomic and cultural issue in our society that is of much bigger importance than we might place on it as we think. It's been considered by some to be the greatest threat to women's health in particular in the modern world because of its dramatic relationship with increases in breast cancer, problems during the prenatal and postpartum periods, etc. But even more important, it may be one of our main national security weaknesses. As I mentioned, adolescent obesity is going up at a rate that now one-third of every kid who finishes high school in this country is not medically acceptable by current American military physical requirements. One-third are taken off the table in a time when we've been in a war for a longer period of time than we were in World War II. And we can't get enough people to enroll voluntarily in our military services because they aren't physically fit enough to do what we would ask them to do. One of the nurses in my own clinic at Duke was discharged from the Army against her will because after 6 months, she still could not get her weight down to the maximum weight level for female medics in the Army. It's also dramatically, for the first time in recorded human history, potentially going to be the first thing ever that has decreased our life expectancy. Forever.